Hello, everyone. My name is Jennifer, and for this discussion board 3, we were just to consider all of the readings that we had for this week and from our field experience, and just discuss any kind of challenges we may have encountered between different disciplines and professions as it relates to communication, ethics, and a focus of intervention. And then we were also just supposed to discuss if we would like to work in a host setting. So, as it relates to challenges between disciplines and professions, as far as like communication, ethics, and focus of intervention, in my limited experience through just my time in the field and my different internships, I have learned that, people from different professions, even like, counselors, psychologists, medical providers, things like that, they work under a different kind of code of ethics. So they aren't always looking at things as necessarily we would as social workers through a social work lens, where we have our very own code of ethics and then different values and beliefs, especially as it relates to, making sure the client is self-sufficient and, helping maintain and build, client self-determination, things like that. So I think that as it relates to what I've seen in the field, for client self-determination is probably where I've seen the biggest discrepancies between professions. And in my current placement at the VA, at the Dover Clinic, you just see kind of, especially if you have a client who has like mental health or substance use, and of course, you have recommendation for treatment such as medication or groups or counseling, things like that. However, the client is the expert for themselves, and so they may not always agree with that kind of recommendation. And so really all you can do is just support them through the moment and continue to be there, and just help to try to educate the client until they're ready to seek these kind of services. However, when I'm in the clinic, you just overhear different conversations from maybe the nursing staff or medical providers, just, and how they disagree with, what the client wishes, things like that. And so from an ethical standpoint, like I said, as a social worker, that can sometimes be difficult to manage and just navigate, because you're really just advocating for the client and that they are the expert for themselves. So as it relates to host settings, the article that we had to read was very interesting, and it made some key points. It talked about how host settings for social workers, you can find like just the devaluing of social work itself, discrepancies between professional missions, values, and then like the social work code of ethics, and then difficulty with maintaining client self-determination. Prior to my job that I have now, I worked, I guess it could be considered a host setting. What I did there, I worked for a transitional housing program for homeless veterans, and I was the case manager there. My primary responsibility was to assist with case management needs, and the number one goal was always to obtain housing for the veterans. I was the only social worker in that program. The other staff, it was interesting. My director, she had, I think, a degree in physical therapy. So it was very difficult managing self-determination for the client, as well as like focus of intervention, and just helping the client become self-sufficient. It was a struggle because her natural tendency was to kind of just jump in and do for the client. And I felt like there was several instances where I was working harder than the client because we weren't trying to help them become self-sufficient. It was kind of just doing the work for them. So that was not a very pleasant experience. I didn't stay very long because it very quickly burned me out. And I'm afraid that experience would make me hesitant to go back to another host experience, just because When you are working for an agency, an organization, and you're the only social worker there, that can sometimes feel isolating and kind of lonely because there's nobody else with a like-mindedness like you. And so it makes it difficult when you're advocating for, different changes within the program, and advocating for the client, and you're kind of the only voice advocating this. Another experience that maybe would help me move into like a host environment in the future. I have a lot of experience with the homeless population, case managing, various demographics, with the homeless population, untreated mental health, substance use. So I think all of those practices would help me in a host environment. Maybe one of the things I'm considering post graduation is maybe, going into the prison as a social worker. And so I really think that the different experiences I've received through employment, education, and internships, that, it would give me a good skill set to kind of go in and work with vulnerable populations, and different demographics, things like that.